Thereafter, there was no case again. Nevertheless, even in that interim period, immunization activities and primary healthcare delivery services continued. Surveillance, which is the process by which we detect cases, also continued. Community mobilization and awareness creation continued. And then by 2016, after 2 years, and we are expecting Nigeria to be certified polio-free by 2017, but in 2016, after 2 years of being polio-free, cases of wild polio virus 2 in the first instance were identified in Borno, and specifically in Goza local government area and Jere local government areas. And these cases, the background to these cases had been that because of the insurgency due to activities of Boko Haram, selected areas, selected parts of Borno State were physically inaccessible, which means service delivery was not going on well in that area that was highly security compromised. And therefore, vaccination team members, routine vaccination as well as even campaign activities could not reach those areas. And so with the intensified action of the military and with the successes recorded by the military in liberating those communities, access was made available, which also made the place accessible, partly or partially accessible to our surveillance team members, and then those cases were detected. So these emergencies have been somehow as a result of the inaccessibility occasioned or caused by the insurgents, the activities of the insurgents in that area.
You see, but we had this issue of insurgency rather for the past few years, and we still managed to attain that close to polio-free status. How was it managed then, and what's happening at the moment?
We are working together with the military in our planning processes. As a matter of fact, in our planning process earlier this year, in a series of events, in our National Polio Emergency Operations Center, the commandant of the Army Medical Corps, I think it's General Amosun, was in attendance. Again, in a similar way, at the state level, we also have a state emergency polio operations center in Borno State. The commander on ground, they also repeatedly participated in our planning processes. And not only that, even on ground, in the field, at the front, their medical personnel are also on ground, and we are in liaising with them and working with them. They also deliver those outreach services. In addition to that, the military personnel also accompany our vaccination team members in those security compromised areas. And we believe that as they continue to make gains in terms of liberating communities and improving access, the frontiers of service delivery will continue to improve.
So how long will it take us right now to regain our polio-free status?
As of today, apart from those 2 cases, we have not had another case. So even as you and I speak, in the context of today, and even yesterday, and hopefully tomorrow, day after tomorrow, and next month, we would like to, now we are polio-free as of today. No new case has happened since then. So our target will be to work hard towards ensuring that the present scenario whereby we don't have any child paralyzed today again continues.
But when we have inaccessible areas in the places you mentioned, yes, in the northeast, are we still hopeful?
We are hopeful because the liberation effort continues. And as more communities and families and households are liberated, we move in. And we believe and are very optimistic with the support of the military that in that way we will then overrun that geographic land space that has remained inaccessible and attain 100% accessibility. Once that is achieved in terms of accessibility, 100%, we will then overrun the environment in the fight against polio, and we will hope that polio will be out. And even at this stage, we form a kind of a frontier or a barrier whereby as communities are liberated, anyone coming out, is promptly addressed. Any children coming out, from the liberated areas are promptly addressed in terms of vaccination and other healthcare needs.
What areas can't you still access?
Well, we are unable to access a significant part of Bama local government area, those close to Lake Chad, some areas of Goza local government area, some areas of Monguno local government area. These are all parts of Borno State.
Let's now look at some donors, from including UNICEF, recently urging the government to strengthen primary health centers, and then we're looking at pockets of disenchantments, grievances on how facilities are at this PHCs, and of course a lot of people saying they can't really get the services as at the time they want it, and even those who really can't access the care in the PHCs. What are you doing to strengthen the system?
Well, we now have, you can call it a policy or a strategy or an approach of making at least one lead health facility in every ward effectively functional or optimally functional, whereby all services, basic or essential services will be available. It will entail strengthening the infrastructure, bringing about improvements in infrastructure inclusive of water and sanitation as well as hygiene in those health facilities, deployment of requisite members of staff, health workers to those facilities across the country, and again ensuring that commodities and other supplies are available. And then the other component of it is mobilizing the communities, creating awareness as regards what they need to do about their health and also for them to access those facilities. That is the strategy now, and with that we are hopeful that we can achieve universal health coverage, bringing the services close to the people in those locations in every ward. Access to the ward headquarters or a central location in the ward is not really very difficult on average across the country. And with these services in place, and once this policy is implemented in full, we believe that better service will be delivered, better quality service will be delivered to the reality of Nigerians in terms of equity, to also address the issue of equity, making it available in ways that people can and will really use.
Well, hold on your thoughts, Dr. Emmanuel Odu. We'll be right back on issues to do with primary health care in the country. Please join us again.